Hi, I am Riaz Khan. This is Paraminicogenesis. In previous video, we will discuss about the commonly used muscle relaxant named Atracurium. In this video, we will discuss about the another muscle relaxant in the anesthesia practice that name is Vecuronium. Okay. First, we will discuss about the classification. Okay. We already know that Vecuronium comes under non-depolarizing muscle relaxant, and chemically it is a steroidal compound. Chemically, non-depolarizing muscle relaxant is divided into two types. One is the benzyl isocyanine, another is a steroidal compound. So Vecuronium is the steroidal compound, and it duration based upon the duration of action, it is a intermediate acting muscle relaxant. Okay, according to the classification, we know about these informations. Okay, then we will discuss about the availability. How we can see the Vecuronium intake as okay. So Vecuronium is comes a liposide powder. What is a liposide means? It is a freeze and dried. Okay, so it comes at the powder forms. It have a vial 4 mg and 10 mg. So it comes under vial as a liposide powder. That means please that the dry in the vial it have a drug amount 4 mg and 10 mg. It's have availability of the Vecuronium. Then we discuss about the mechanism of action. So we already know previous video and last video we will discuss about the mechanism of action of the all muscle relaxant. So non-depolarizing muscle relaxant, all type of non-depolarizing muscle relaxant have a same mechanism of action we discussed earlier. That is a competitive antagonist. Competitive antagonist in neuromuscular junction. So if you know about the, you check the previous video, you definitely understand the concept of the mechanism of action of all type of muscle relaxant. Okay. Now we discuss about the pharmacodynamics. Sir, pharmacokinetics. So onset. Onset means how much time will drug take action. Okay, that is a 2 to 3 minutes. That's why when give a Atracurium or Vecuronium, after administration, we will wait for the intubation around 2 to 3 minutes, 3 to 4 minutes, very we okay. That is our onset and duration. Duration is around 25 to 40 minutes. That's why it's called intermediate acting muscle relaxer. Then protein bonding. It is a 50 to 80 percentage. Okay, 50 to 80% of drugs is bound with the protein, especially albumin. So pre-drug is very small. That's why it have a intermediate acting muscle relaxant. In previous video, we learn about this concept. So check it the video also. Okay, and BB volume of distribution is around 0.2 to 0.4 liter per kg. It's nearly body is a paleo. Okay, that's why drugs is distributed all over the tissue. Okay, that is a Vecuronium pharmacokinetics. Then we discuss about the metabolism. Metabolism also it comes under pharmacokinetics. Okay, it is mainly metabolism in hepatic, like all type of drugs. Hepatic metabolism. Okay, it has a active metabolite. Okay, Metabolism is metabolized and it have an active metabolite is called 3-desacetyl Vecuronium. So Vecuronium is the 100% action, but it active metabolism if 50 to 80% they have a action, same action as like a Vecuronium. Okay, so it is a very important point in the metabolism of the Vecuronium. So it have active metabolite. It's called 3-desacetyl Vecuronium. Now we discuss about the elimination. It's also concerned on pharmacokinetics. It's mainly eliminated in two different way and majorly biliary elimination. Okay, in biliary elimination, 60 to 80%, and kidney also kidney elimination. But renal elimination also 20 to 40%. That's why the not given patient like a kidney disease or liver disease. So atibarium is preferred for that type of patient. Okay. Why use of Vecuronium? We should know about the prolonging factor of the Vecuronium. Now we will discuss about that test. What is the prolonging factor of the Vecuronium? It's divided into two types. Okay, it's a patient factor and diet factor. First, we will discuss about the weight factor. First, the liver disease. A patient with liver disease have a compromised liver function. We already know that the Vecuronium is metabolized by hepatic metabolism. So, a patient with the liver disease have a decreased metabolism. Okay. Use the rectal. Okay. Decreased metabolism. That decreased metabolism is leads to prolonging of the Vecuronium. And the next one is the kidney disease. A patient with the kidney disease, we already know that the Vecuronium is excreted through kidney. A patient with the kidney disease have a decreased elimination of the Vecuronium leads to prolonging of the Vecuronium action. Okay, and the elderly patient usually have a compromised hepatic blood flow. Hepatic blood flow and decreased kidney function also is lead to prolonging of the Vecuronium. And hypothermia. Hypothermia in our body, all enzyme activity is decreased during hypothermia. Okay, enzyme enzyme function is decreased during hypothermia. Even 1 degree Celsius decreased its lead to decreased venal blood flow. It makes difficult to metabolism and elimination, makes prolonging effect of the Vecuronium. Okay, so hypothermia also one of the factors. So during the extubation, we should go from the from the muscle relaxant. We should know about the hypothermia. Okay, concern about the hypothermia. And last one is electrolyte imbalance. Electrolyte imbalance, three major conditions: decreased potassium level, decreased calcium, and increased magnesium. Okay, Asian cripples. Okay, decreased potassium which is called hypokalemia. In hypokalemia, the membrane, muscle membrane is less excitable. Okay, even a small stimulus it make a prolonged action. So during the hypokalemia, it makes a prolonged factor of the prolonged action of the Vecuronium. And calcium, decreased calcium, that is hypocalcemia. Okay, we want to know the physiology. In now, the calcium influx its next release of the acetylcholine in the neuromuscular junction. Okay, the calcium is very important to the release of the acetylcholine. So calcium is decreased in the blood. It makes to decreased acetylcholine level. So regain of the muscle neuromuscular contraction takes time. That means the prolonging effect of the Vecuronium. And magnesium, the calcium and magnesium are like a CSKMI. It is a opposite. Okay, it is a very enemy. Okay, the calcium enemy is magnesium, magnesium enemy is calcium. Okay, so the calcium is decreased, the magnesium also increased, the magnesium increased, it makes calcium decrease. So same physiology appears. This makes the prodding effect of the Vecuronium. Okay, now now we will discuss about the drugs factor. In drugs factor, the first one is the inhalation agent. Inhalation agent used along with the muscle relaxant, it decreased sensitivity to acetylcholine. So acetylcholine is not bound to the receptor. So it makes a prony of the depronium. But in everyday practice, we use it along with the inhalation agent. We use the vecuronium along with the inhalation agent. Aminoglycosides, gentamicin, and amikacin latex. Okay, it decreases the acetylcholine release. Okay, so it leads to the prolonging effect of the depronium. And clindamycin also decreased acetylcholine effect. In local anesthetics, the nerve conduction is decreases. So that's why whenever GA with any type of nerve blocks, it makes more effect of the muscle relaxation. So that the reason is the nerve conduction is decreased during use of local anesthesia. Okay, and maxal. We already know that magnesium is the opposite to the calcium. So calcium is very important to the regain of the muscle regain and normal physiological nerve contraction. So normal physiological contraction is absent. So the muscle relaxation is promoted. So that is a factor of the muscle relaxant, prolonging factor of the muscle relaxant, especially a vecuronium. Like a prolonging factor, the vecuronium have a factor of the decreased duration of its action. Okay. First, we discuss about the burn as a decreasing factor of the duration. In those patient, after 20 to 48 hours, in his body due to the stress response have extra junctional receptors. Okay, extra junctional receptor means in normal neuromuscular junction, normally we have a 4 receptor in the muscle end plate, but in this condition the number of receptor is increases. That means extra junctional receptors. Okay, so due to its increased number of receptor in the muscle end plate, it required high dose of muscle relaxant or vecuronium. In this case, vecuronium. Okay, high dose of muscle relaxant is required to produce the side effect. So the extragensual receptor is makes duration of the vecuronium is less. And second condition is upper motor lesion. Like spinal cord injury, um, stroke. Like a patient have a denervation condition. In denervation condition have a extradental receptor like a Bond's patient. This makes a high dose of muscle relaxant required, which makes a decreased duration of the muscle relaxation, especially in this case vecuronium. And third one is anti-convulsant therapy. Convulsant therapy. A patient with anticonvulsant therapy have a increased hepatic function. That means hepatic enzyme activity is increased during the use of anticonvulsant therapy. So increased hepatic function makes increased metabolism. So decreased duration of the muscle relaxation, especially in Vecuronium. So these three factors decrease the duration of the Vecuronium. We should know about this condition also with use of Vecuronium. And doses of Vecuronium is very important. The intubation dose is 0.08 to 0.01 mg per kg ID, and maintenance dose is 0.01 to 0.02 mg per kg ID, and infusion is 1 to 2 micrograms per kg per minute. It is a dose. So Vecuronium is emerged by Neostigmine 0.04 to 0.07 mg per kg IV along with the atropine or glyco. It is a anticholinergics. It decrease the nicotinic function, especially radically. Okay. And second one is the Sugammadex. Sugammadex is dose is 2 mg per kg. It also used to reverse the Vecuronium action. So hope in this video I will discuss about the full pack of pharmacology about the Vecuronium. I will meet another video as soon as possible. Until signing off, Jarias, and this is Paramedico Genesis.